responsible for the healing process of the cellulose medicines. And then came Samuel Hahnemann. He is the father of homeopathy, and he described that you possibly can cure a disease with the symptoms. That when you cause the symptoms, that the causative agent or the disease causes. So if the patient has fever, give him something that reduces fever. This means similia similibus. And today still there's a very strong movement around the world, but especially in Germany, Austria, and Switzerland, of the homeopathic group. And they are a very close environment. And they keep sometimes away from the academic community and are rather hostile. If you touch anything that claims that there's only the dilution of 10 times to the 9, so about 9 blood points, then it is one drop in the ocean. And I think he gave the best example for placebo effect already at this time. Medicine was produced in the alchemist laboratories with a very sophisticated reporting system from France. Today we are in a high-tech lab with online IT reporting system to all uses, and this is for the pharmacy and for the normal laboratory in the hospital. And then there is another movement that is rather sad for the patients, because between the doctor and the patient came the machine. Wilhelm Röntgen detected the X-rays, and Ferdinand Müller constructed the first anode, and today we put the patient in a tube and we have this instrumental medicine, and sometimes the patient is far from the doctor. The doctor doesn't have any more time, and it sometimes is a technique and not an art. But we have now a movement in the research area. Here, the BKZ is one of the biggest cancer institutions in Germany. They found an anti-cancer drug in the treasure of the TCM products. And this is artemisinin, normally used for malaria, but it has an extremely good effect on cancer in melanoma. Artemisinin, coming from the plant Artemisia annua, is very active against cancer cells. It binds to the load of the iron load, and it uses an aggressive O2 radical that leads to explosion of the cancer cells. And the researcher hopes that they will do much more with this treasure of the TCM ingredients and plants and herbs. And the question is this an enduring bridge between East and West? Now, coming in Europe, it is a rather sad story. I have to say that I'm a little bit jealous of our American friends that are much further in the integration of CAM in conventional medicine. The definition of CAM, as Ernst and another English doctor described, complementary and alternative medicine has been defined as any diagnosis, treatment, or prevention that complements mainstream medicine by contributing to a common whole that leads to a more holistic perspective, by satisfying the demand, and not by orthodoxy or by diversifying the concept of framework of medicine that meets the demand mostly of the patient and not yet of the academic doctors, at least in Germany. So, going back to the year 1997, there was a positive movement because the European Parliament adopted a resolution that claimed, nevertheless, the Assembly believes that a common European approach to non-conventional medicine based on the principle of patient freedom of choice in health care should not be ruled out. And they launched, asked the Commission to launch a resolution, to launch a process of recognizing non-conventional medicine, carry out a thorough study into safety, effectiveness, area of application, and the complementary or alternative nature of all non-conventional medicines with a view to their eventual legal recognition. In formulating European legislation, make clear distinction between conventional medicines that are complementary in nature and those which are alternative medicines in the sense that they replace conventional medicine. So, as far as the providers are concerned, the Assembly believes that the best guarantee for patient lies in a properly trained profession. We don't have that yet, and CAM is mostly done in an environment outside the academic community and has a system of ethics and self-regulation that is also subject to outside control. This group tries to inhibit outside control and is very vicious if there is anything said negative. And I and many of my hematology and oncology colleagues had a lot of lawsuits when we did say anything negative or had studies that show it was not working. Therefore, many of the European hematologists and oncologists try to keep their hands away from CAM because it is really dangerous to touch it and show negative results. So this is the situation now in Europe. In 2002, there was a tender of the European Union in the fifth framework, quality of life and management of living resources. And since then, unfortunately, no money was spent by the EU, and it seems that the EU will not do anything further for funding research or care in CAM setting. But there was one cancer project funded by the EU, concerted action for complementary and alternative medicine assessment in the cancer field. There was a group of 8 people that sat together from Switzerland, Norway, the Cochrane Cancer Network, England, Germany, Netherlands, and the ERTC. And the background was that we had the impression there is increasing use of cancer patients, and it has to be something done that we know more about efficacy and safety. Oncologists often are uninformed about CAM. There's a lack of objective and authoritative information and a need for open and constructive dialogue. Because we know very little about the efficacy and safety, and we have to do something to get an independent information on CAM and get a critical appraisal of the medical evidence. So the objectives were to create a network around CAM cancer with experts in CAM research, medical literature reviews, patient support and information, and cancer care. And it was that there should be scientific evidence by literature and produce and disseminate suitable evidence-based information for the doctor and the patient's dialogue that was not existing yet. So the deliverables were a website, a systemic review, Cochrane guidelines, and CAM summaries on information background, promoter claims, and safety issues and efficacy. So far, the information on CAM cancer in Europe, you can go to the internet and look at that, is